So I'm pretty sure the whole conference was pretty long. And the very first thing I want to talk about, because I'm pretty sure you guys are all drained out, so I want to make sure you guys are charged, okay? And let's talk money, okay? But this is another thing, and I want to promise you something, is I have got a gift for every single one of the person in this room today. And inshallah, I'll fulfill that promise, okay? But here's the thing. Of course, if I'm supposed to fulfill the promise, it's suppose I have to get something out from you. So I want to ensure every single person in this room acts like they're alive. They're not sleeping. Okay? So let's start with the name of the one who's the owner of the dominions of the heavens and the earth, and who created us, you, and everyone in this room. Bismillah ar-Rahman ar-Rahim, in the name of Allah, the most gracious and the most merciful. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. So, first of all, I'm pretty confident that majority of you don't know me, who exactly I am, what exactly I do. Maybe Dr. Abdul Samad, Dr. Lareeb, Dr. Aksa. But one thing is for sure, in the next 10 to 15 minutes, every single person will know who exactly I am, what exactly I do, and what makes me credible enough to stand over here. Well, definitely you guys are alive. You're not sleeping. I like it. I love it. Amazing. Now, I want to take you back in the 1940s. My great-great-grandfather, Dr. Deen Muhammad, he had two practices in Amritsar. His son Khizr Hayat had his own practice. And his son, Muhammad Salim Akhtar, which is my grandfather, Alhamdulillah, is alive. He had his own practice, which he opened in 1993, and he closed in 2018. You see, he wanted my father to become a BDS doctor. He wanted my father to hold a handpiece. He wanted my father to sit in the chair you guys are sitting today. But you know what exactly he decided to do? He decided to sit on a chair who decides whether that person is bailed out or acquitted. Is bailed out or acquitted or goes behind the bar. Okay? And if you're smart enough, you should have guessed it right. He's in judiciary. So, you know, I looked on my right shoulder, nobody was there. I looked on my left shoulder, nobody was there. And looked behind, nobody was there. I wanted to ensure the legacy my great-great-grandfather, he started in 1940s, the door stays open. So what exactly I did? I took a leap of faith, and I took a front step, and it actually landed me here. Today I'm standing in front of you. Now today I'm not here to talk about the clinical stuff. I'm pretty sure we had a lot of it. Let's talk something interesting. Okay? The thing I'm going to talk about is something everyone knows how important it is for them. They know what are the disadvantages they typically face by not using it. Is there any person in this room can tell what exactly that is? It starts with the word S, with the letter S, and ends with S. Anyone? That's a good one. Anything else? So the word is systems. There you go, systems. So you see, I have been in the digital and business space for the past 8 years. And I have been testing, breaking, building everything by myself. I have worked with millions and millions of dollars worth of companies. I personally have run successful 5 different companies. And on top of what exactly happened, I want to ensure the door stays open. I left all of that just to ensure the door stays open. And right now, what exactly I'm doing, I've got 3 different things. Selenic AI. It's an AI operating system for modern dental practices. Okay? All the way from receptionist to ledger to scribe, you name it. Secondly, what exactly I do, I host a podcast between patients. I specifically invite top dentists all across the globe. I conduct an interview with them to find out what are the mistakes they made and how exactly any other dentist out there can succeed. And thirdly, which is something that's really close to my heart, is Denticular. You see, dental schools, they teach you how to become a great clinician, like the best amongst all. They teach you how to be really steady with your hand, but they never teach you how to run your own practice one day. I would like a quick survey. How many of you over here is currently dreaming, have ever dreamed to open up your own dental practice one day? Can you raise your hands? All right. I see a couple of individuals. Great. That's wonderful. So on top of that, I'll be definitely covering, because I've been invited as a guest speaker in Margala Dental Institute to talk about should you open your own dental practice or not. But I'll definitely cover that. Now, has any person in this room ever called a dental practice pretending to be a patient? Anyone? Nice, I see that. Okay, sweet. Now, again, my grandfather, he was really steady with his hands. He ran his own business for 25 years, and it was just the business side that actually wore him down. But I want to ensure over here that I personally have called dental practices hundreds of times through every single hour of the day, and there was just one common response. The dentist is in the practice. The dentist is with the patient. I never got the chance to speak to the person who was going to put his hands in my mouth. Never. So that being said, it's very interesting. This is one of the reports that's been run across 4,280 calls. If there are 10 patients calling a dental practice, 4 times the calls are going to be unanswered. Nobody's there to pick up the phone because the receptionist is at lunch. And there isn't even a one peer-reviewed study on the unanswered call for dental practices. On top of it, what's really fascinating, I want you to think from the patient's perspective. Now, this is very important for all these young dentists out there who plan to start their own dental practice one day. It's very, very important. Think from the patient's psychology. Because when a patient is in pain, what they typically do, they're going to ring the practice 1. If the practice doesn't pick up the phone, they're going to call the second practice. If the second doesn't pick up the phone, they're going to call the third practice and the fourth. And whoever picks up the phone first books an appointment with them, and the patient gets a chance to sit in their chair. Now, on top of that, what's even interesting is there's an American sales data. If a patient sends a message to you and you don't reply within 5 minutes, whether that's WhatsApp, email, forms, you name it, if you don't reply within 5 minutes, the probability of you booking that patient in your diary decreases by 30%. And if you reply within 5 minutes, the probability of you booking that patient increases by 30%. Now, typically, patients need you when you're closed, when the practice is closed. Inshallah, every single individual out there who's got their dream to open their own dental practice one day, the patients are going to call you when your practice will be closed. So it's important you should have a system for that. You know, the system I talked about. So there's one peer-reviewed study by Austin and his colleagues at the BMC Oral Health 2009. It was run across 2,100 patients. And 90% of them said it was urgent. 72% of them said they had sore toothache. And 50% of those patients wanted to book an appointment on the weekend when the practice is typically closed. So it's important you should have a system for that. But you know, everything I've talked about is money. Okay? You know, it's all money. You know, patient calls you, you book an appointment, they sit on your chair, they pay you a couple £100 or couple thousand rupees. Okay? But what's even interesting, it's far more important beyond this topic, which is dentistry is breaking its dentist. 55% of dentists, they report high job stress. 44% exceed the ability to even cope with that stress. And 17.6 dentists, they're thinking about suicide. You know what that means? If we're in a room, there are 100 dentists sitting, 17, which means 18 dentists, they're having suicidal thoughts. What exactly this means for a practice? This means that when the dentist is in the practice, he's not thinking about money. He's anxious, he's burnt out, he's stressed out, which means it's going to directly impact the treatment itself. His hands are not going to be steady. The patient is going to come back to the practice. If he's not pleased with the treatment, he's going to ask for a refund. Instead of him spreading positive word of mouth, he's going to be spreading negative word of mouth. And lastly, I've said this one out loud. I've had podcasts with Dr. Bazga. She's an implantologist. She works in 5 dental practices in the UK. And what's even fascinating, we haven't done any sort of clever marketing. It was all organic. And dentists, the way they responded, we got 89,000 views on Reddit, 39,000 views on Instagram. Why? Because the dentists were able to correspond with that. They were able to resonate with it. And again, when you inshallah open your dental practice one day, I don't want you to go out there and spend a fortune on artificial intelligence. But what I really want you to do is meet where the patient meets you. First of all is the phone, automate it. Secondly is once they have booked the appointment, it's important for you to ensure they show up into the practice, because a practice that has a chair in it and a patient in it is equal to the practice that has got a chair with no patient in it, because it's the same thing. It's worth the same amount of money to your practice. And thirdly, the follow-up. Patients come to your practice, if they book for some sort of hygiene, after 6 months, it's important, and AI should be corresponding with them, engaging with the patient to book them back in your diary. And this is something very, very important. I can't ignore this fact. Is a clear-headed dentist is a better dentist. You should not be doing the admin work. You should not be doing the repetitive task. Get an automated system to do that. And again, the patients should get the best of you, not what's left of you. And there you go. So this is an AI voice receptionist. It picks up your call 24/7, 70 plus languages. Urdu, Punjabi, you name it. At least let me give you the gift, yeah? You guys want the gift. There you go. This is the gift for everyone. A live training from the denticular team, from the best dentist in the world, on how to run your own practice one day. The business side of dentistry will be taught to you for free, everyone in this room. Every single individual. So what exactly I want you to do is scan this QR code. This is my personal number, but scan this QR code if you want to. This is how you can avail the free session on how to run your own dental practice one day. Just move aside. Of course, this is my personal number. Don't spam me. I shouldn't be giving out, but still, you guys are my brothers and sisters. I trust every single one of you. You have my number. And I believe that is it. That's pretty much it. Short, easy, quick.